Okay. Again, so my name is Ryan BROD. I'm a Doctor of Health Science candidate. A little short background on me. I've been a personal trainer, PE health teacher, wrestling coach. I've also been a strength conditioning coach working with the Navy SEALs for almost 4 years. Just that kind of accumulates my experience. I just want to give a short presentation today on basically what it says there, the hip stability weakness and its effect on lower extremity musculoskeletal system. I feel like this is something that you all could use in your profession. I used to be a personal trainer. Sorry if I made some noise there. I used to be a personal trainer, so I understand how my knowledge was a little bit limited, and just having little things like this added to my tool belt on helping clients. So if I can give you any kind of information to help you guys, that's good for the community, good for everybody. So, all right, so just some things we're gonna be going over. We're gonna be talking about the hip weakness and what identifies in those muscles are, sorry, let me start over. We're gonna be talking about hip weakness and what primary glutes or muscles are used in that, in the hip girdle area that are related to stability. Also, we're going to discuss the hip problems caused by weakness, and also some biomechanical chain reactions of how that hip weakness affects other parts of the body, and then also how to prevent those. That's obviously what we're really trying to get you, is what the issue is and how to take care of it. So without overwhelming you with too much information, the main ones that we really want to focus on here are talking about the glute medius and the glute minimus, okay? There's 3 of these muscles. However, if you look closely at the glute minimus, which is that picture here, you can see that it connects right onto that femur, and that's a key part of this presentation. The glute medius is really crucial for pelvic stability, single leg walking, running, and the glute minimus also assists with pelvic stability. So if you guys can see what the main features on here, the main concern is stability, okay? And when you first hear that, and a lot of clients I've had and a lot of other trainers that I've trained, they're like, stability, sure, it's important, but okay, I'd rather just get strong, right? I just want to get buff or, get endurance, but there's a lot more to it. We'll go dive into that a little bit more. But stabilizing the femur is key, because what it does is that keeps that femur in a straight line. So when we're walking or we're running, that bone needs to stay pretty much on track. Anytime that it goes left or right, that's when we can have issues, and that's where that kinetic chain starts to have problems. And I'll show a diagram later with some video showing exactly how that happens. But just to give you a little bit of preset, that's what's going on, is that we're focusing on that glute medius, maintaining that femur into a nice straight function, so that it can do its job and not cause any further injuries. We'll get into that more. So. And then this right here is a TFL, the tensor fasciae latae muscle. It also is used for stabilization of the hip and knee. It's also used for hip abduction, internal rotation. Again, a lot of these are all about stabilizing, and I'll go into why that's important here in a minute, but just kind of want to give you a little bit of a background. I know some of you guys as professionals are pretty familiar with this, just so I don't want to beat it up too much, but just want to make sure you guys understand what we're kind of dealing with here. So. All right, so I'm going to show these quick videos on how these actually work. So the function of the glute medius, and this is actually its function with all the other muscles taken away. So there's abduction that occurs. Okay, so this is mainly the muscle used for abduction. Of course, you have other muscles that are involved, TFL, your hip flexors, glute, maximus, things like that, depending on what angle you do. But the key here is, if you see, is the hip stability. So in that video right there, you've seen that the hip dipped down, and we'll go on a video on this one too. So the hip dips down, which is really important for stability. So we want to keep the hip straight up, and that is one of the problems that we have with having weak glute medius or fatigued glute medius, because what happens is there's compensations, and then there's wiggle room in that femur, which you see in that video there. the femur is going to internally rotate or externally rotate. And usually what happens is they internally rotate, causing the glute maximus, because the glute maximus is usually weak if the glute medius is weak. That's usually what we found. So by having that glute maximus weak as well, usually it's not pulling externally rotating. So you're going to have those knees go in. You probably see this a lot with squatting, right? With the valgus, where the knees bend in. That's usually an indicator of weak glutes, right? In one way or another, whether it's glute maximus, minimus, or medius. So again, our focus is on the medius, but if you see in this video here, that is the main function. So all those functions that you see there are for movement, right? Running, lifting, or squatting, climbing stairs, okay? So it's very important in keeping that femur in the right position, okay?
Here's a prime example of this, right? Just walking, hipped it.
Okay, so this kind of goes back to the whole reason why I got interested in this topic, because it was a concern for what I did prior. I was a strength and conditioning coach, trained about 4,200 candidates going through SEAL training. And we obviously have a lot of musculoskeletal injuries in that department. Any kind of special warfare, you're gonna have that, or really military, right? Any kind of exercise, athletes, things like that. But this is on a whole nother level. And this is at the beginning stage. So before they even go through BUDS, they are going through us at the time. So 7-week program, we get them, and they're all, some of these guys are in shape, some of these guys aren't. Some of them are straight out of high school. They've only ran, they never lift weights. So they have the cardio endurance, but they don't have the muscular endurance for things like this. So what we noticed is that these candidates were getting through week 3, week 4, and all their injuries start to show up, which is fairly common. The most common, as you see there, is musculoskeletal injuries related to knee pain or runner's knee, ITBS, which is iliotibial band syndrome, which is the IT band. We'll talk about that here in a little bit. And plantar fasciitis, lower back pain, okay? Those are all related to glute medius. They can be related to other factors as well, but the majority of these candidates, we notice that a lot of them have weak hips, and they're coming out of high school. They've never done a side plank before. They've never done anything that's stimulated that glute medius other than some air squats. They're not doing Jane Fonda's at the gym, right? So they come here and they're expecting like, okay, we're just gonna exercise and I'll get stronger, but they don't realize all the intricacies of it. And that's where coaches came in. So we notice this with a lot of the candidates. They're beat up, they're having knee pain, they're having hip flexor pain, they're having plantar fasciitis, things like that. So we realize that a lot of this is coming from uneven surfaces. So these guys are running on the beach, they're running up berms, they're running in terrain that's uneven or undulated. So what happens is those hips are put in overdrive. They have to maintain stability. So they're overactively firing. But if they're already weak and they're not really flexible, they haven't been stimulated, they fatigue. And when they fatigue, they basically don't work anymore. We all know that, right? So now they're not working anymore. So knees start to bend in, toes start to bend in, and they start having all these shin splints, knee pain, things like that. So that's where this is kind of flowing into. And the problem becomes instability and compensation, okay? There's a lot of studies out there, but just to give you a few of those, one of the biggest ones that I use for my research, I apologize, I keep hitting the microphone. One of that I found with the research is that up to 40% or over 40% of clients, or sorry, people that went through this study, they had ITBS and they were found to have very weak abductor when they were doing their testing. So those that had ITBS, iliotibial band syndrome, which is basically inflammation of the iliotibial band, okay, they found that over 40% had very, very weak hips or abductors. And that was a telling sign that, hey, there's something, that's a big red flag that there's something going on related to those. And the main abductor for that is the glute medius, as we've seen in the video earlier. Another study showed that knee overuse injuries had very, very low absolute strength in their hip external rotations, extensors, flexors, all of that, okay? Because it's basically saying, hey, these guys are weak in all these areas and they're having knee pain. You know, there's a correlation between that. And there's a lot more studies on this and you can look them up, but I just want to give you two of the basic ones, or two of the really good ones that I've used that really tell the tale of like hip strength is related to knee pain, knee issues, shin pain, etc. Okay. Now, one of the other issues that we have too is compensation. We see in a lot of this as well in just athletes too that don't train their hips or glute medius, but also mainly the candidates that we trained. So stabilizing the lumbar spine and the pelvis is the quadratus lumborum. Some of you all probably should know that, right? So this muscle is mainly used for stabilizing the spine. However, if you look at the video, sorry, not the video, but the picture here that I've shown, when the glute medius fails to externally rotate or lift the leg up and make that hip stable, making it not come down, then what happens is something has to do that. So something has to tell the brain, or the brain's telling the body, we need to get these hips stable or lift that leg up, etc. What happens is these QL muscles compensate. So now they're pulling on the top of that hip girdle on the iliac crest, and they're pulling it up to keep it stable. So what happens is the QL is not used to doing this all the time. So it overworks it. And the muscle gets tighter, no one stretches it. They don't know how to even stretch a QL or how to foam roll it or anything. So what they do is they just kind of stretch as best they can, but they always say that I've noticed is they're going to point at the top of their hip girdle and say, it hurts here. And when I test their hips, usually they have weak hips, and I tell them this is probably the reason why you have lower back pain. And so something really good for you to know for your clients is if any come in lower back pain and they're pointing at the hip girdle, I would definitely do some hip testing just to make sure that that's probably what's leading to that. It's a kinetic chain issue, right? In the other picture there, you see a normal hip versus Trendelenburg sign, which is their hip sags. And we'll get into that here shortly.
Anita just blew her back up.
Hello?
Exactly what you're dealing with.
Okay.
Sorry.
No, you're fine. I didn't know if you had a question or not.
No,
so
good.
the glute medius weakness testing. So there's a couple things you can do. Now, I know that for manipulating, it has to be done by athletic trainer or a doctor, somebody that's qualified to manipulate, chiropractor, things like that, massage therapist. However, for personal trainers, there are some things you can do. And one of the easiest ones is be like a functional movement screening. Okay, most of you are probably familiar with that. A deep squat test or just a basic air squat test to see if their knees point in, okay, heels lift up, things like that. That'll give you signs, well, not really the heels lifting up, it's separate, but if their knees cave in, usually that means weak hips. I think that's a pretty standard thing to know, right? Another way to do it is a Trendelenburg test. So Trendelenburg test is really, really simple to do if you haven't done it before. I'm going to show a quick video here on how it's done. So they're just going to go to the wall, lift their knee up and hold it. And then I usually like to hold it for like 20 seconds to see if it's very weak. After 20 seconds, they'll start to like shake a little bit. They're not used to holding that position. So it'll dip down, and it's going to be the left side usually, right? Because it's not pulling that hip straight. It could be more likely it's both, okay? Because even though one side's not so well, it's more likely the other side, okay? So that was just a quick video on how that works, so you can use that for your clients as well. So putting it all together, weak glutes equals instability in the femur equals LEMSI, and LEMSI stands for lower extremity musculoskeletal injuries risk, okay? So what can we do? Everything that you would think of as a personal trainer, the basics, starting with side planks. I always like to say a good two or three sets, 20 seconds is a good place to start. Open clams with resistance bands with sit to heels. The sit to heels are really, really good if you haven't done those. It's basically doing an open clam and then trying to, as you're in that position, trying to get your butt all the way down to the back of the heels. So you're doing like a sit, almost like on your knees, but you're still elevated with your hips up. That really fires the glute medius. Is probably the best that you could possibly do. I used to do it with the candidates, and we would hold it for about 20 seconds, 30 seconds, and they'd feel it and it'd burn. So the other one is hip point.
Right.
Hip airplanes is a good one for stability. And then really just any stability band or external lateral movement using those hips with the resistance is great. Of course, you can adjust that based on the client if they had, they're not very strong or they just need to just do basic body weight first or up to a wall and just doing lateral movements, etc. And doing
On those
about
clamshells, Ryan,
say
quick
again.
question on the clamshells, right?
Yes.
So, okay, so we're in sort of a side bent position, hips on the ground, right? 90-degree hips, 90-degree knees, band around the knees or whatever, just
Okay.
above. So we do the clamshell, we open the knees. Are we saying drive the hip off the ground and into extension or keep it in flexion as we're bending? I mean, both are valuable for different areas, but I'm just curious where you were going with that previous
So
clamshell.
yeah, so it's kind of it's almost like the knees are in flexion, but
Okay.
they're kind of not because you're sitting, and when you
Okay.
sit, bringing your butt to the heels,
Yeah.
the knees stay fixed because they're on the ground, but
Right.
your chest does come closer to the knees, if
Okay.
that makes
We are
sense.
we're flexing the hips, right? Is
Yeah.
what you're trying to get
So
at?
you're
Okay.
basically going here, you're kind of sitting,
Cool.
coming down.
Okay. So we're trying to
And
lengthen through the hip.
it's you could feel it as a regular clamshell, but when you sit, it really fires the glute medius. It's probably the best exercise you could fire it. I wouldn't even recommend it for someone who's novice, like haven't worked
Okay.
out, because it probably will. It's pretty intense. So like a side plank is fine for
Okay.
some at least, and then when they build up their endurance, I'd recommend trying that. And there's with the resistance bands, etc. So
Yeah. I mean, there's a million ways to do a hip abduction. Would you say there's value to doing hip abduction through a flexed hip and a extended hip, right? When it comes to the sort of medius and minimus, doesn't it prefer to be in an like the side plank picture you have here is extended, right?
yeah,
Does the medius perform better through extension?
it performs with isometrics really because
Okay.
its job is to isometrically keep things
Stabilize.
stable.
Right.
I'm not 100% sure on any studies on if flexion, like concentric or
Yeah.
eccentric, is it
Yeah.
better one way or the side bend? You know what I mean? Lateral.
Okay. Yeah.
It's from all the studies I've looked at, it's more for stability
Okay.
and lateral extension, so or abduction. So
Right.
if you wanted to work that, it's such a smaller muscle too. It's not a big powerhouse, so
Yeah.
it's designed just like the abdominals to be an endurance based, a slow twitch
Okay.
muscle. So it should be
Yeah.
used for
Lot
stability.
time, lots of repetition, keep it isometrically loaded.
Yeah,
Okay.
isometrics is great, especially because if a lot of the studies, it's going to take about 2 to 4 weeks. So let's say we
Yeah.
have a novice person never worked out before, and they have no really experience. And the first thing that they're going to get strong from is neuroadaptation, right? So we have 2 to 4 weeks is usually the study that they're going to
Yep.
develop some strength from that neuroadaptation. So if you have someone that's doing it for 2 weeks and they can hold a side plank, used to be for 20 seconds, now they can do a minute, like
Right.
that says a lot. They could
Okay.
probably get pushed for a little bit more with
Yeah.
resistance bands, weights, etc.
I mean, I'm this one's extremely interesting because obviously, as you can imagine, right? I mean, this is 90% of what I see with our clients is weak hip abductors and unstable hips in general, right? And then they go, yeah, you're right. They go point to their low back, and you're like, well, QL is probably stabilizing too much. And we have
Mhm.
this one client as an example. Her name's Anita. She has a severe hip drop, right? And she hasn't quite gotten it checked out yet, right? But what I've noticed is hip abductors are extremely weak, so even stabilizing in a side plank causes her pretty bad pain. I do think she has some syndrome, so there's some compression.
Yeah.
Her hips are extremely anteriorly tilted. Um, and where I'm going with this is like a side plank, even on the knee, causes her a lot of distress and discomfort in the
Yeah.
low back. And so trying to find a modification that will allow us to still get into that position and strengthen those tissues without, incurring too much pain is one
If
of the challenges we've had.
if she's an anterior tilt, you said,
Yeah. Yeah.
I think
Pretty
that
bad.
doing the clamshells with the knees up would be
Okay.
able to target it really well
That makes
and
sense.
still
Pulling it
prevent
back.
pain. Yeah.
Okay.
Because
That's
I
good.
don't
I guess
know
so. Of
what's going on specifically with her anatomy as far as like what's
course.
causing, I don't know her, but I'm just off what you said. If it was me, I would try to get away from the side plank if it's hurting her, bring the knees up,
Okay.
and then try
Okay.
the clamshell, and just see how it goes.
Makes sense. Put
Especially
in a
if
little
it's,
bit
yeah,
more of a posterior tilt
yeah,
to work it. Cool.
yeah. Let's see here. So I was going to ask for questions
Yeah.
if you guys had any, but if you guys have
Light
any
'em up.
questions, it's really straightforward.
Mhm.
I wanted to get through pretty quick because I know how PowerPoints are kind of boring sometimes, right? So
Mhm.
we just want to make sure you guys get the basic information, kind of like the experience and what you can do for that. I think that it's really helpful, but the key thing that I've learned from dealing with over 4,000 candidates in the time that I did was majority of those just have weak hips, and it led to
Mhm.
so many issues that could have been prevented. They get rolled back for, to the next class because they have runner's knee and they can't walk, or, they had some sort of IT band syndrome or something like that, right? And a lot of that is
Mhm.
just weakness in the hips because no one does that. We don't go to high school and they don't teach you how to train hips, which is something
Not
that
at all.
I think that most need to learn and do. Um, and that's kind of what you guys, I think, giving that knowledge to clients, I think it'll be beneficial when they say, oh, like my back hurts. And then you say, oh, well, let's just do some side planks. Hey, my back doesn't hurt anymore. Like
Yeah.
just that simple.
Yeah.
It could be instant. Like
Yeah.
within, a couple minutes, they can have relief. And it's just basic anatomy and understanding the physiology of the body.
Yeah. I mean, hips are very much the kind of the centerpiece. I call it the main core. Um, as you can imagine, Ryan, like a lot of what we deal with here is very inactive folks. We're talking
Yes.
sedentary, 90% of their day. And so, most of them will actually have more of a posterior pelvic tilt, and then their knees go valgus, often with a lot of patterns, very weak
Tight
abductors,
hip flexors, I'd imagine too.
very tight
Yeah.
hip flexors, right? Got a client recently diagnosed with, psoas syndrome, right? Had some severe sort of compression pain on the femoral nerve. But, the volume at which we can target those tissues here is a bit challenging and actually working through it. And then, of course, we give feedback, hey, do this at home. And what, do they? I don't know. But the hip girdle is the biggest thing we deal with. We got lots of clients who have knee pain, lots of clients who have low back pain. One question I have for you is the QL. What's kind of some valuable takeaways in either strengthening the QL? We do rotation here. I know that helps with neutral hip, neutral spine.
Hmm.
Austin's really good at sort of helping them label that neutral hip. I mean, how do we get into a stretch position? Is it torso rotated side bend type of thing? I mean, I
The
have one in
best that you
mind that I
can,
use with
I would,
TRX.
I'd say the best that I've found successful in is, I don't know what you would call it, but knee up to chest laterally across,
Okay.
opposite leg straight, and just basically doing a torsion twist. So
Okay.
lumbar twist, basically, and then pulling on that leg. And then there's also something called a QL claw. And I showed that to Jay before, I believe, right?
Is it
I
a
showed it to you
tool?
or no? I can't remember.
Yeah, maybe.
Okay.
Sounds familiar.
But it
It's
looks kind
like,
of like a horseshoe.
yeah, it's like that psoas one, but for the QL.
I actually, yeah, you
Oh,
can
those are
use it for the
nasty.
psoas,
Oh
but
yeah.
Yeah, yeah, okay.
it has a little hook.
It's hard to get to the fucking psoas, dude. It's
1 minute,
impossible.
I can grab it for you.
I love that. Jay would definitely need this.
Yep.
So this is a really hard form of rubber.
Yeah,
It's used for a lot of different things, but this is mainly the QL. So
that's
what
nasty.
happens is this goes right into the abdomen
Okay.
and
Oh,
basically just massages it and
I
tries
want
to
to throw
loosen
up.
it up. You can do it from the front, which is
Yeah,
kind of an issue, but if you go from the back, you can't really, you can, but you have more soft tissue I think, in the front, so it's easier to get to.
yeah,
But this right here is something that you can use on the back as well, where the QL kind of
yeah,
inserts.
yeah.
And
Look,
what I noticed is if you do a lateral like torsion twist and you get something like you can use your knuckle and just grind on that hip girdle where there's usually it's going to be the tighter part of the
Yeah.
QL,
Yeah.
it'll break up. That's
Okay.
something that you all, because that's manipulating, you guys can't really do, but you can inform your
A lacrosse ball or something.
yeah, get a lacrosse ball, or just
Get him in a
having
position.
a massage therapist say, "Hey, this is what I was told I could probably do to help with some QL relief. Just doing a lateral, and could you just get in there deep and just kind of break up that while I'm in that position, in that fixed
Yeah.
position."
Okay.
I know personally for me, I've had that issue, and I know it works for me because I've had tight QLs,
For
and
sure.
that's why I got that actually.
Yeah.
And it's something that's really beneficial. We do that lateral and just kind of grind in there, but
Yeah.
leave that up to them to decide to tell the massage therapist or whatnot.
Oh, they'll be screaming. That's a
Yeah.
nasty one. You got to put a lot of pressure on that.
Yeah.
That was good, man. So when it comes to, all these other compensations that clients are dealing with, right? So start from the hips. We got weak hips in general, just say that draws down to the knees. So now we got knee pain, and then like let's say, internal rotation of the foot or inversion, would it be? Whatever it
Yeah.
is. Um, are we priming those other areas as well and trying to focus in on that, or just really driving the narrative of hips? So we can do correctives here, but
Right.
we have limited space within our
Right.
correctives because of the way our program's set up. So are there other areas in which you would put emphasis on if they're dealing with knee distress from the hips or ankle distress, or is it just really trying to drive the strength of the glutes?
I mean, honestly, there's not just necessarily the glutes, but the TFL too. So the tensor
Okay.
fascial latae muscle, which is also
Yeah.
used. Now, here's an interesting part too that I didn't really go over, but it's kind of interesting is your TFLs, and just like part of the hip flexors, especially those that sit all day, they're
Yeah.
obviously going to be in a flex position, right? So when they stand up like really tight, like
Yeah.
right? Well, obviously that can lead to back pain.
Yeah.
So making sure that those are flexible and not always in that tight position is
Okay.
really important. So they do also end up compensating. And we used to do this because a lot of the clients do flutter kicks, right?
Yeah.
And I used to tell them a little trick. I was to tell them like, hey, when your hip flexors are on fire, just point your toes either in or out, and you'll kind of
Oh,
like
yeah.
use different muscles to kind of compensate.
Yeah.
It's almost like when
Pulling
you
the
run,
TFL or IT.
yeah, so tell somebody like, hey, run more on your toes, kind of give your
Yeah.
calves more of a workout, kind of give everything else a little bit less, just kind of
Okay.
like balance out what muscles are using what. That's if
Okay.
they're in tune with their body. Some people that just come in, they don't really know
No.
how to flex anything, right?
No. Yeah.
The TFL is one because when that glute medius goes out and they're lifting, let's say they're doing agility movements, that and that requires a glute medius, that TFL will compensate, and that'll start overactivating. And if it's already tight, because they're they're going to pull it, they're going to pull hip
Yeah.
flexor, and now they're out for a few weeks. So I would say definitely
The-
the TFL,
Okay.
QL,
And the
IT
TFL's
band.
main the TFL's main function, abduction, does it drive what external rotation of the hip as
The T,
well?
the 10th
Is
here,
it,
let me go back. I can actually show you.
yeah, because I know it's a primary abductor, but does it have any? Is
So
it internal?
the interesting part is that it is connected, like I talked about here, to the glute medius, so and the IT band, because they all work
Yeah.
together. That's kind of
Right.
where it all has issues with IT band or iliotibial band syndrome. So it's mainly used for stabilization, but it does help with the abduction and internal
Yeah.
rotation.
Okay. Internal.
Yeah, for
Okay.
the TFL.
Oh yeah. Okay.
Yeah.
I see.
And that's
Okay.
mainly, you can kind of do it yourself. That's kind of like where I was getting at with the flutter kicks.
Yeah.
If you do a flutter kick and you just kind of relax, point your toes for internal rotation, you'll feel like it's more on the outside lifting that hip or the leg up, versus if your toes are straight up, it's gonna be more internal, doing it externally rotating. So that's why I used to say like, hey, just rotate when you feel like you're outside of your TFL or your inside your hip flexors are getting really fatigued or tired, then we should say
Turn the
just,
femur.
you can externally, internally just rotate, just kind of, it's still going to be used, but it's not as much. It's kind of the same way of, we used to
100%.
say, I used to tell my guys when they start having tennis elbow, or they start having, not tennis elbow, but golfer's elbow,
Yeah.
that they could start, or tennis elbow or golfers, to instead of doing pull-ups with their full fingers, just let your pinky and ring finger just kind of hang there and use your thumb, index, and middle. And that way you don't put all that extra stress on that tendon.
That makes sense.
Little things like that is kind of what I did, just kind of to help get the guys to do the work with the minimal amount of pain so they can get through it. And just get more in tune with their body.
Yeah. Oh, yeah, that's our biggest challenge. We got clients who are like trying to drive a hinge, right? We're like, all right, we're gonna go push our butt back against the wall, neutral spine, bend over. What do you feel? Nothing.
Yeah.
Nothing. You don't feel anything? Nothing's working right now? Nope. All right, we got some work to do.
Awesome.
That was
Yeah,
good,
I would say
man.
keep the basic things you guys got going, especially because they're all new, your basic assessments and all that. And then if those come up, I would definitely use those tests. If you haven't already, the Trendelenburg's a good one. Just, it's real quick, and say, hey, your hip's falling, or they start shaking. You'll notice, like, if they have really weak hips, within about 30 seconds, you'll see them like, it's burning. They just don't have that. You can hold an external rotation, and it's going to burn, which is another way you could do it as well. Something simple.
We
but
use the
we'll
FMS as
work
our
on it.
main protocol. So FMS is our driven protocol for assessment, and that helps, right? I mean, it gives some oversight, right?
Yeah.
Like you said, knees go valgus, other things happen, torso forward, all that stuff gives us some insight of where their compensations are at. And then once we get them on the floor and start moving, you can start identifying some of those weak points and working with them.
Awesome.
Again, within our program, there's only so much we could do, but
Of course.
very
And I wish you
valuable.
could manipulate. It's like it's so much easier to determine, but
No, this is great, man. This is incredible. Just the hips are everything.
they are, especially coming
Garrett
from
was
wrestling.
right, dude.
We're big on the
Garrett
hips.
knew it from the beginning, man. Hips don't lie.
Well, that's all I have for today. If you guys have any other questions, feel free to ask them. If not, then let you guys go along your day. Really appreciate you taking the time out to go over this with me and share some knowledge with you.
This is sweet, Ryan.
Thank you,
Appreciate you,
Ryan.
man.
All right, guys. Take
Thanks,
care.
Ryan.
Cool.
Appreciate it.
Thank
All right.
you.
Later.